Alright, so this is our final assessment video. I'm just going to look at your skin, okay? So the skin is olive in pigmentation. She has a mole macule on the left anterior aspect of the arm. She has distributed hair across the arms as well. The skin temp is warm and dry, looks well hydrated, non-tenting. Let's see the legs. Where's the legs? The legs are also warm and dry. She has a mole macule on the right side anterior front of the leg. She has some varicosities bilaterally. There is no edema noted. The toes are slightly warmer than any other part of the body. Okay. Let's see your hands. The fingernails look like they have good adherence to the nail bed. There's no opacities, no rigiding. They're smooth. Cap refill is less than 3 seconds. Can you do this, Mom? Not like this with the fingernail. Okay, like this. Not like this, the pointer fingers. Oh, turn your hand this way, like this. Put your fingernails together. Alright, there's no clubbing noted of the fingernails. Alright, so the hair looks like it has some baldness, alopecia on the anterior top portion of the head. On the lateral sides of the head, the hair looks coarse and dry on inspection. Let me feel. The hair is slightly coarse on inspection. It has no infestations, no dandruff. Scalp is movable. Alright. So we're going to take a look at the eyebrows. Eyebrows look symmetrical bilaterally. They are midline, they are full, they are dark brown, such as the hair color. Alright. Then take a look at your neck. Neck, no JVD noted. Trachea seems to be midline. Can you swallow for me? Okay. I'm going to feel for lymph nodes. Mole. There is a mole on the right side of the posterior chin. No lymph nodes noted, no lymph masses on palpation. Let me see your thyroid. Can you swallow for me? Okay, let me go back here. Can you turn a little bit this way? No. Okay. Turn the other way, please. No masses, no calcifications on palpation for the thyroid gland. Okay. Take a look at your eyes.
You're supposed to put the video down again?
Yeah, and a little bit in the middle. Looking at the eyes, the iris is brown in color. The conjunctiva is pink and moist. The sclera is white with some vessels noted. Let me feel your lacrimal. Any tenderness there?
Nope.
Lacrimal duct and sac, no tenderness noted. just going to look into the eye, okay? Red reflux is noted. Optic nerve, fovea, macula, pearly white in color. Do this bilaterally. Okay. I'm going to go ahead and I'm going to look at the nose right now. The nares look symmetrical. The right side is larger than the left. The septum is intact with no deformities or defects. Mucosal is moist. There is hair bilaterally. Your ears. Going in, I see hair in the eustachian tube. Also see some serum. Am I hurting you, Mom? Tympanic membrane is gray, pearly in color. Stapes, malleus, all intact. We would do this bilaterally. The pinna, the helix, is unilaterally with the eyes. Rebound on the helix. Any tenderness back here? Okay. Can I see your mouth, please? Close your mouth. The lips look moist, non-chapped, intact. Can you open your mouth for me? Mucosal is pink, is moist. I'm going to count her teeth. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25 teeth. There is one missing tooth in the left lower bottom portion of the mouth. There are dental caries with fillings bilaterally on both sides, upper and lower. There are some plaque buildup on the teeth. There is some receding on the bottom portion. Let me see. The Whartons and Snellans are intact, palpable. The tongue, stick out your tongue for me, has some rigidity. Can you move it side to side? Okay, stick it back in your mouth. All right. Okay, we're gonna do, can you smile for me? Can you smile without your teeth? Can you frown? Downward? Okay, can you blow? Can you go stick your tongue, okay? And that is for facial facial cranial nerve number 7. Let's see here. I'm going to actually listen to your thyroid and listen for any bruise because I miss doing that. Turn around and use the back portion. No bruise, but airflow is heard.
You need to do the video.
Oh, I'm just going to show you that I'm not using any kind of papers or cheat sheets or anything to that effect. There we go. I'm also going to do part of your hearing since I forgot to do that. We're going to let me know if you hear it in both ears or hear it?
Mm-hmm.
Tell me when it stops. up?
No, it's up.
Okay. All right, we are going to look at the chest portion of you. The chest looks symmetrical. There is no barreling of the chest. There is no kyphosis or lordosis of the back. I'm just going to go ahead and just listen to you regularly. Just breathe normal, okay? Can you lift your arms up like this for me? Listen to the back. Turn this on. They are clear bilaterally. There are no adventitious breath sounds. Alright, so can you just lay down for a second? I'm going to do kind of a breast exam. Alright, so lift your arm up. We're feeling here in the tail of Spence for any lumps or masses where the armpit area is. There is none noted. For any lumps or masses in the breast area, there's none noted, and I don't believe there's any discharge. Okay, just keep laying there because I'm going to listen to your chest. Listening to her heart. So we're going to listen in the second, actually, you can see it, second intercostal space on the right side border, the aortic. Second intercostal space on the left side is going to be the pulmonic. Third intercostal space is going to be Erb's point. Fourth intercostal space is tricuspid. Fifth intercostal space is the mitral valve, which also is the PMI, which also is the apical pulse. All within normal limits. Lub dub is heard. I can use the little bell to listen as well. So lub is the tricuspid and I think mitral valve. No murmurs, no clicks noted. Let's look at the abdomen. Alright, so the abdomen is flat, it is intact. It does have a C-section scar going from the umbilicus down to the pubic area. She does have positive for striads from her previous pregnancies. I'm going to take a listen. She has positive Gaussans. They are active. Tell me if you feel any tenderness or pain. None noted. No tenderness on palpation. The liver is going to be on the right-hand side area. So I'm going to be measuring for the liver. There's my pen. It's going to be about 6, which is, I believe, in normal limits from 6 to 12. I am palpating the liver. No rigids, no calcifications. Doesn't feel enlarged. Feeling for the kidneys here, renals. They are movable and palpable. And of course the spleen is not going to be felt, which would be on the left-hand side. All right, let me sit up for a minute. Sit down. So I missed this portion of her, say 99.
99.
Yeah.
99.
Yeah.
99. 99. 99.
All right, she is positive for tactile phremesis. I'm going to measure for diaphragmatic excursion. Take a deep breath and hold it, Mom. About 3.5 inches. Alright. I want you to just sit up for a minute. I want you to, can you close your eyes for me? I'm just going to have you sit down. Close your eyes. I'm going to have you smell something. We're just testing for olfactory, which is cranial nerve number 1. Actually, hold one nostril for me and breathe in and out. No, one nostril, like this. Okay, breathe in and out. And then do it on the other side. Okay, good. All right, now close your eyes. What do you smell?
Oregano.
Yeah. And then, again.
Cinnamon.
Yep. Okay. Okay.
Yeah.
And can you stick out your tongue and move it side to side? And that is for hypoglossal. All right. Let's see here. Already did that. I want you to lay down so we can do your legs. Okay. So what are we gonna do? I want you, can you raise your leg up for me? No, just raise it straight up. Okay, that's flexion. That's flexion. I'm gonna put it down. That is extension. Okay, now raise it up against my resistance. Okay, and lift up. Now push down on me. Alrighty. Now can you bend your knee? That's flexion. Can you make it straight? Extension. Okay, now do it against me. Okay, and then again, down. Okay, good. Now we are going to put your leg like this, and this is, I believe, adduction, and then we're going to rotate it outward, adduction, okay, all right, and we are going to put this heel in, which is inversion, and turn it outward, which is eversion. And then also I'm going to hold, just rotate your ankle for me. Okay, good. And we would do this bilaterally as well. I'm going to feel for pulses. This is the temporal pulse. It's carotid pulse. Brachial pulse. Radial pulse. She would have the femoral pulse here. popliteal behind the knee, dorsalis pedis on top of the foot. They are all within normal limits. I'm going to listen to with the bell, the temporalis, perbruits, and the carotids. And no bruits heard. Alright. Will you stand up for me, Mom, for a minute? Stand up for me for a second. Close your eyes for me. Okay, she is positive Romberg test. Can you walk this way for me? Just open your eyes. Just walk across. Okay, can you come back with your heel to your, like this, toe to toe? Okay. Okay, good. Now I want you to stand over here in front of me. And I want you to do, let's do your neck. We're going to do flexion, down, extension, up, and hyperextension. I want you to roll your neck. I want you to go left and right and back and forth. Okay, now I'm going to do that against my push against, behind, side, side. Okay, good. Now we're going to shrug your shoulders. I'll do it against resistance. Good. And now we're going to do flexion over top of your head like you're swimming, extension down by your side, hyperextension like you're flying. Okay, now we're going to do that against our resistance. Go, push it, yep, and then back, and then this way. No, 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 just your arms, like this. Okay, and then down, press down. Okay, good. And then we are going to, can you flex your elbows? Extend them. We don't hyperextend those. Good. And what about do your wrist down and then up? Just your wrist. Okay. Now we're going to do open up your fingers, close your fingers. Okay, good. Try to open them. All right. Open your hands. Close them against mine. Okay. So we're going to try to push up with your fingers, down with your fingers. How about with your wrist down and up with your wrist? Okay, good. All right, we're going to, what else are we going to do here? That's that, that's that, that's that. Okay, so I'm going to hand you something in your hand. Close your eyes. And I want you to tell me what it is.
It's a dime.
Okay, good.
Or penny.
That's
whatever.
stereo. And graph, I'm going to draw a number in your hand. Tell me what number it is, please.
3,
No.
8, 9.
Mm-hmm. Good. I'm going to touch you with, tell me if it's sharp or dull, okay?
Dull.
No.
I can't tell. Sharp. Dull. Sharp. Dull.
Okay. And then keep your eyes closed. This is going to tell me you feel 2 points or 1.
2. 1.
Okay, which is within normal limits.
2. 1.
Okay, within normal limits.
2. 1.
Which is within normal limits. And also, I want you to feel, I need a soft, something soft. Okay, so this, you feel this?
Mm-hmm.
Soft?
Yeah.
That's testing trigeminal nerve number 5. And let me take a look at your eyes. I didn't do this portion. Lights are equal and reacted pearl. Look at me. Sclera is clear. All right, I want you to look at here. Okay, we would do the Snellen test for distance, and we would do the Romberg test for near vision as well. Can you close one of your eyes? Okay, and I want you to tell me when you see the bunny.
I see it.
Okay.
I see it. See it.
Okay. Hold on. Keep your eye. No, keep that one.
I see it. I see it. See it.
Okay, good. Now I want you to keep your eye covered there. And I want you to look over here. Don't turn your head, just keep your eye. Look at your eye over here. Now let go of this hand. Put this hand down. while you're looking here. Look at this. Stop turning your head. Look at it with your eyeball.
I am.
No, you're not. Look at it. Take your hand off. Look at. Okay, no, it's a nice
What are you
diagnosis.
doing?
You're trying to look, make sure that you're looking at the same portion.
Well, you say take your hand out, so you know if I take my hand out.
Okay, I'm trying to think of if there anything that I missed. Who's the president?
Obama.
Repeat after me. Queens Creek, Williamsburg, Virginia.
Queens Creek, Williamsburg, Virginia.
Okay,
Queens
stop.
Creek,
Stop.
Williamsburg,
Stop
Virginia.
repeating, that's enough. If I told you I had a letter and I had a stamp on it, what would you do with that?
I mail it.
Okay. What else am I supposed to? I'm trying to think if I forgot anything. Okay. I think that I'm all done, and hopefully I didn't forget much.